course, hospitalizations and ICU admissions have also risen. Joining me now, Jean-Paul Soucy, co-founder of the COVID-19 Canada Open Data Working Group. Jean-Paul, great to have you back on the program.
Thanks so much for having me.
I recall one of our earliest conversations when we were chatting about the situation. We were talking at that point, I believe, about a potential second wave in this pandemic. We are well into the third wave, and one thing that you talked about was focusing on the trajectory of where things were going with this virus. Based on what you saw and you were looking at then to where we are now, and I certainly know that the variant's playing a large role in this, what is your take on our situation here in Canada?
Well, we're in a very frightening situation right now. I think something that a lot of epidemiologists emphasized back at the end of the second wave was in regards to the ICU numbers, because remember at the beginning of the second wave, our ICUs were pretty much empty of COVID patients. But that certainly wasn't the case coming out of the second wave, and that put us in a very precarious situation because, as we said months ago, if those case numbers turned around, then we'd see those ICU numbers turn around from a much higher level than they began at the beginning of the second wave, and that's why we've seen, for example, here in Ontario, the number of people in ICU with COVID-19 utterly eclipse the peak of the second wave, and it looks like it's just going to keep going up because our cases are going up. And it doesn't really show any sign of stopping yet.
Talk to me about how the variants are now playing a role in this, and again, you yourself looking and marking this data and watching where things are going.
Yeah, so it was quite clear that we were looking at the numbers back during the second wave, during that first stay-at-home order, and back then there was relatively small numbers of variants, but they were capable of growing even during that lockdown, even during that stay-at-home order. And even though, when you start from low numbers with exponential growth, it seems gradual at first, but then it explodes, and we see the high levels of cases that we see today. So I think what we saw back then and what's happening now was completely predictable, and things are unfolding basically pretty much as we feared would happen if we opened up too much too quickly.
And that's what I wanted to ask you about. It sort of led into the next question here. The measures that are now being put in place because of, as you say, the numbers of where we're going. We did open up, and that was a question that we asked a lot of our health experts. Are we opening up too quickly? And there's that fine balance. But what we're doing now, the direction that we're on now in terms of restrictions, action that's being taken, are we headed down the right path? And what does it need to look like for us to have this conversation and say, we are now seeing a much brighter light at the end of this tunnel because we've been able to bypass now the variants, and the vaccines are certainly winning this race?
Yeah, I mean, one thing that is encouraging is, the weather's only going to get nicer from here. We're going to have people spending more time outside, and that's obviously a good thing with respect to a much lower risk of transmission. But we certainly, it's good that we're taking action with the stay-at-home order, but that's not going to really help a large segment of the population of essential workers that are still working in workplaces that are in person, and we're seeing large outbreaks in those situations. So I think we still need to have more targeted support there, especially with regards to being able to take the time to get tested and to isolate till those results come back without fear of losing your livelihood or the ability to put food on the table. We do need to speed up our vaccination program, and we do really need to put in those economic supports to cushion the obvious economic impact of the measures we're enforcing to tamp down this third wave.
Yeah, certainly so many measures that need to be put in place, but all of them sort of needing to make that connection so that we're doing this at a unified effort here. Jean-Paul Soucy, co-founder of the COVID-19 Canada Open Data Working Group. Jean-Paul, always great to have you. Thanks again for this.
Thanks so much for having me.
You're welcome.